From iowapodcast.com, I'm Justin Brady, and one of the things everyone's talking about right now is the healthy stuff you're eating, or maybe not so healthy in some cases. It's kind of a Rubik's Cube, isn't it? You go to the store, you have to read labels now. People sneak all sorts of labels into things, and it is affecting your life. It's affecting your health. It's affecting your family. And all that stuff, you have to eat it. It has to go through your teeth and right down your throat into your stomach. And so who better to talk about that than Dr. Corbin Brady, the owner of Brady Dental Care, who joins us today. First off, nice last name.
Right? No bias there.
No bias at all. So one of the big questions I know you get a lot is kind of a general overview of people's dental health. Like they don't know what certain things mean. So let's start broadly. Are there any major signs that people can kind of self-check? Like, are there any things people should look for that let them know they're on the right track, things are going well, or stuff that maybe should be a sign that things aren't really going so well?
Yeah. So, I mean, obviously we get usually for most people, the very kind of more obvious things, which is motivating for dentistry is pain, So most of the time we get most people, the time they're aware of a problem is when they have pain, toothaches, jaw pain, swelling, anything like that. So I'd say it's usually what drives most people to come in and get it checked out, which I'd say is the biggest signs there. And then there's the small signs. We get sometimes people that are focused on the small things like, oh, yeah, my gums are bleeding. Oh. Is that normal? Should I be paying attention to that? Or, man, my breath really just reeks all the time. It stinks. Sometimes we get those smaller things. So it kind of depends. But, yeah, we get sometimes people that are focusing just on the major things. Like, we get some people that feel like they have to wait till they're ready to go to the hospital before they start noticing something.
People wait that long?
Oh, yeah. I mean, I'll have times where we'll see it, like large, gigantic infections, abscesses, and they're just kind of trucking along as if it's just normal and it's just what they have to deal with. And, I'm trying to be like, hey, like, this could send to the ER this weekend. It's like, we got to do something about it. And they're like, doesn't hurt. So I can just wait, right? I'm like, no, we can't wait. Like, this is not something we should deal with next year. Like, we should deal with it tomorrow.
So people are waiting past pain. If they basically what you're saying is if someone has pain in their mouth, if their teeth hurt, if there's some pain up there, they should go get checked. Like, that's kind of an obvious sign. I
mean, I think that one should be universal, but yeah, once again, some people not. But I think that's at least kind of like, if you go by like your rungs of stuff you should pay attention to, like, yeah. Infections, pain, yeah, definitely.
Why do you think people ignore that? Where does that come from?
Ooh, I mean,
you may not know the answer to that. I don't know.
I mean, if we all do, right? I mean, obviously, in healthcare, I think there's an overall thing of sometimes there's just denial for a lot of people. It's just kind of ignore it because you don't want to deal with it. You don't have to come with the reality of what it could mean. You get stuff like that for all the time that people have issues for years, but they're afraid of what they might get told, what they have to deal with, Dentistry specific, I think that plays a role into it too. And I think as well, dentistry is known for a lot of people to have a lot of fear with it, So I think a lot of people, it's traumatized as children, bad experience as a kid or an adult. And then I think that also becomes a big thing because, they have pain, but once again, if they had a bad experience and the pain was worse getting the treatment done, then a lot of times that's going to be even more of a hindrance for them wanting to get it done.
In general, then, if there's a little bit of pain and they immediately go check it out, is that usually a pretty easy fix?
I mean, once again, everybody's pain tolerance is different. So, I mean, sometimes, you get some people, it's like the moment a cavity's starting in the tooth, they can tell. Like, they're like, oh, yeah, my tooth's sensitive. I know something's off. And sure enough, there's like a cavity that's just getting started. Not a bad problem to deal with. Easy fix. And I get some people, it's like half the tooth's gone and the tooth's dead and infected. And they're like, hey, something's starting to bother me. And I'm like, how did you not know this was there? But once again, I think some people, it's just they're highly aware of their health, what their body's telling them. And some people, that's just they're missing the cues because I just feel like, oh, well, that's normal for me. And it might not be what's normal, but that's just what they feel like is normal.
Right. So in general, though, if they ignore pain, it's probably not going to go away. It's probably going to get worse.
Usually not. Yeah. Once again, you can get some stuff that's random pain that we have, like somebody bit on something hard. They bruised the tooth a little bit. Give it a couple days, it'll be fine. But most stuff we find most of the time is, something that's only going to get worse.
Sure. Okay. So you mentioned like gums bleeding and bad breath and that. Mm-hmm. These are early signs that there may be a dental issue?
Definitely. Oh, really? Yeah, especially bleeding. Bleeding, yeah.
Okay, so what's that a sign of? If there's gums bleeding, something, that's a signal. Your gums are bleeding. That's a signal something's wrong.
Yep.
What's wrong?
Yeah. So, I mean, once again, not getting the nitty gritty, which I'm always guilty of at work. Most common 90% of the time is just the immune system responding to basically an insult. And the insult usually is bacterial overgrowth in the mouth. You know, too much plaque's been sitting there too long. Too much of the bad bacteria are starting to take over, and your immune system's responding to that, you know? So immune system's basically sending all its responses to that area, making the basically blood vessels basically dilate so they can get more part of your immune components to fight these bacteria. And so the first time is bleeding. And once again, gums are very more porous, you know, is maybe the word I should use, as opposed to like your skin. So like, yeah, your skin might just get like red and kind of itchy, but your skin's not going to bleed. You still have that permanent barrier. Gums, yeah, you push on them, yeah, they'll bleed.
Oh, interesting.
Because they're that basically open. The membrane's a lot more open to getting things in and out.
So gums bleeding is another sign. If your gums are bleeding, go in earlier the better. You can probably clean that up. If you wait too long, it's going to turn into an infection or something worse.
Yeah, infection. You could have loss of basically bone density in that area, bone structure. You know, teeth can get loose. Sometimes it's literally a cavity. All the above. Yeah.
You mentioned bad breath earlier. I think people just assume, oh, bad breath just means I need to pop a mint. That's all there is to it.
No.
You're saying bad breath could be a sign of a dental problem, or always is a sign of a dental problem?
Yeah, I don't know if I'd say always. I mean, you get some people out there that are saying, oh, yeah, it always is, because I think there's always something to be done, you know? I mean, maybe it is, but I'd say the research I've never seen is out there. But I think it's always a good sign to pay attention to it. Yeah, are you doing an incomplete removal of basically like plaque or food debris afterwards? Yeah, good chance you are, you know? And once again, could be the fact you're doing a good job, but maybe your mouth's on the dry side. You have a dry mouth issue. Once again, some people that becomes their normal for them because maybe they're on a prescription medication that, you know, be nice if we could get them off of it, but they're on it, dries their mouth out. When you have a dry mouth, you're not going to have saliva in there, and you're going to get bacterial issues again. And then once again, sometimes it's just something more complex that people have a hard time finding out. But once you dig deeper, you can find out it's other signs of other health issues as far as liver problems, you know, detoxification issues, gastrointestinal issues, but those are a lot more harder to prove. So I think that's why I think you have to be limited in saying, oh yeah, it's a sign your liver's, I've seen people say that, oh yeah, your breath smells bad. You need to do a liver detox program. How do we know that? Maybe, but there's not enough evidence showing that, but I think enough that's at least worth looking into.
Yeah. So this is interesting because I think most people assume bad breath is just one of those things that happens or something you deal with when you have food like onions or something. You ate onions.
Oh, sure.
But it's actually could be a symptom of something deeper.
Yes. And I think that's a big thing, is just because I think also too, like, what does somebody find as bad breath? You know, like you said, like somebody who maybe eats a lot of garlic and onions, you might say that bad breath because the sulfur you can smell, but just because there's highly sulfuric compounds in food you're eating, well, that doesn't necessarily mean it's bad either, you know, because once again, garlic, allicin is wonderful for you. So I think it's kind of too, what are you tying to the bad breath, you know? Or once again, if it's from hydrogen sulfide because you have certain bacteria that are producing, well, there's a problem. So I think that's why I'm always a little bit hesitant to say it's always a sign. It can be, but it's a good thing to kind of rule those things out, making sure we've ruled out the problem causes. And then if it's, you're just popping raw garlic, I mean, good luck to you on that. But I can't do that. But if that's the reason why, then I think we're okay.
I think people generally understand the connection with food and health. Like if you eat things over time, you get sicker or better or whatnot. I don't think people make the connection that like some foods are really healthy for your mouth and for your overall health. Some aren't.
Yeah.
Like I think people struggle with knowing which ones are and aren't. And I'll just give an example that I've heard you talk about before. Like fruit juice, because people are like, well, fruit's healthy and therefore fruit juice is healthy. But you tell your patients all the time, like, fruit juice is bad stuff. Stay away from it. What are some examples of foods that patients are eating a lot that are detrimental to their teeth and their mouth, but also their general health?
Oof. Yeah. I mean, obviously, like you're just saying, like overall, like what's the worst stuff out there, or like the stuff that you feel like is more like kind of secretively bad?
Both. Kind of the patterns you see as a dentist. Like what are some of those big offenders that people are legit don't know? Wait, I'm not supposed to be eating this stuff?
Yeah. I mean, there's obviously stuff that I feel like most people know at this point, you know, like your sodas, your candies and stuff like that. I feel like most people are aware of it. There's kind of a denial that it's a problem for them, you know? So I think, you know, I still cover that at work every day, just making sure I cover that. Cause I think most people are like, yeah, I know, I'm just don't want to change my habits, you know? Or some people are aware of like, yeah, me destroying 5 Monster drinks a day. I think they're generally aware of that. Maybe they aren't, but I think they're generally aware of it. They're just have a hard time wanting to make those changes. But then you like juices and stuff. I think people do get confused because it's, it's vitamin C, it's all these things that are healthy in fruits. But, once again, you've stripped out most of the real health benefit and just reduced it down to the sugary components, just like most wheat and stuff like that. I mean, there's still a lot of debate if there's any component of wheat that's good, but
really, yeah.
I mean, some people just say that all wheat forms of wheat are just bad all through and through. You should never eat wheat your whole life, Maybe they're right. I think the evidence is very convincing on it, but even so, I'm still focused on, hey, when you take wheat or any type of basically grain like that, you strip off all the fiber and the nutrients and minerals that are in that husk, and you just get to the endosperm where like all the starches and everything, like that's where we're at. It's so highly processed that literally, like we talk about wheat, like the starch form in wheat is just basically once it hits your mouth, hits saliva, I think they say it's like within 30 seconds it's already being formed into glucose because you have enzymes in your saliva that break it down pretty much into sugar. So that's why a lot of times there's stuff like that I'm hitting up all the time at work when people are like, well, we don't eat candy, but we have crackers and stuff and goldfish. And I'm like, that's just as bad. And then people are like, what? So I'm like, I'm sorry. I told you to get rid of all this. And now I'm telling you to get rid of the goldfish too.
So this is interesting because, as a dentist, a lot of people are confused that in many cases the candy or I should say the crackers and the goldfish, and I see kids snacking on that stuff all the time. In some cases, or in all cases, that could be just as bad as the candy.
Yeah. Oh, yeah. I mean, I tell everybody it's just as destructive. Yeah. I mean, really. And that's why I tell everybody too, like, look what's happening to your teeth. This is happening, same thing down the rest of your health. It's destroying your teeth. It's destroying the next part of your organ system too. But to focus on teeth, those things I definitely kind of lay out as a big problem, which was unfortunate, but I'm backing off all these food groups.
So this is interesting. You just threw something out there that's kind of fascinating. If you have dental issues, if you have dental problems, decay, cavities, bad breath, something like that, those could be signals of an overall like bad body health, like something in the body is bad, not just the mouth.
Yes, definitely. I always try to tie that together with people, I mean, sometimes I'll say stuff which I've realized nobody says anymore, like canary in the coal mine. I'll say that a lot. Like, this is the canary in the coal mine. I'll have a lot of blank looks at it, but I'm trying to get people like, this is kind of the sign you're getting. If you're seeing the damage happen here, you can't see inside your body, but just know that that same damage is happening elsewhere. And if we could show it to you, maybe a imaging of your liver or that maybe on your blood work to see how much, your glucose levels or, your A1C is, that might give you the better evidence to see what's going on inside. But I always try to tie that in. And if it's not happening yet, it's only a matter of time that it's going to, just let's not wait, till basically the damage is done. In our case, it's extractions, removing teeth, infection. But once again, once you get to your pancreas and your liver, it's a little bit harder to deal with that damage. And it takes more time because dental damage can happen fast, but that stuff's chronic, but it will get you at some point.
The brushing and flossing stuff we hear nonstop from the dentists, and I know generally people I think are brushing twice a day, but what are some of those routine things that you just kind of like you smack your head and you're like, I mean, dentists have been talking about this for decades. Why aren't people doing blank? What are some of those big offenders?
Oh, like what are people doing? I mean, same finger can point it back at me sometimes too. Like, why am I not doing this better? I think it's just, it's the will and the desire power to spend time on getting a good routine down. Some of that's just natural to me. I mean, as we know, brushing and flossing has kind of been instilled from birth. So to not do that has been, kind of a hard thing to think otherwise, just like buckling my seatbelt. Like at this point in my life.
Same thing for me.
Yeah, I've been doing it since childhood. So to not do it that way just seems foreign. But for some people, if they weren't instilled from the very beginning of their life, that's probably like, well, that's different for them, which I'm always in my head like, really? Like brushing your teeth before you go to sleep? You don't do that sometimes, but we have a lot of people that they're not doing it. And so to me, that's just like, how in the world are you not doing it? But same thing before, how many times have people talk about washing their hands? You go to any type of sporting event, you'll see 90% of the people walk out of there without touching.
It's true.
So it's like, we know, but it's just, how do you really draw that connection of the reality for affecting people's lives? I think it's connecting those dots has been one of those things that to me, I always thought would be easy. In my job, it's like, I can just show them an x-ray and they'll see their tooth half gone and they'll be motivated to get work done. Or, they'll see a tooth with big abscess and that's easy. Like they'll want to do something about it. And then a lot of times they're like, I'll just wait. So I realized like how much that is a lot more difficult than I thought it'd be, is connecting those dots. And that's where I think,
Yeah.
unfortunately, pain is the main motivator, which I'm like, but we don't want to wait till for that to happen. But I feel like that's where most of us are in life. You know, it's like anything in life, like teaching kids, it's like, you can tell them how much that looking both ways can get them hurt, but sometimes some people, they still don't listen until they see it happen to somebody else, or it happens to them, the damage that can happen.
Brushing your teeth at night. Let's say
I didn't answer your question directly. Yeah.
No. So brushing your teeth at night, let's say someone skips it.
Mm-hmm.
What actually happens in the mouth?
Yeah. So, I mean, it's basically like with any time with the dietary discussion, you know, so once again, like if you're eating anything that's rich in carbohydrates, if you're having anything sugar and stuff like that, if you're not getting the food source out, what's going to take over and eat that stuff? Once again, it's going to be your microbes, your bacteria, your fungus, your yeasts, some other, you know, smaller microorganisms that really never cover, which we won't get into the details of those. But yeah, they're taking over and they're consuming it as well. And then once again, what are they doing with it? Well, usually those food groups are the ones that we're talking about. They're going to just basically keep growing in numbers. They're going to form these complex colonies and biofilms all over your mouth, your teeth. Your immune system's going to have to respond the best it can on the gums. And then on the tooth itself, you know, once again, we talk about cavities, those bacteria literally shooting acid into the teeth, trying to break it up because they're trying to literally eat it, essentially. So you're just basically trying to remove all the source of their fuel, their substrate, so that they can't basically just have a bonanza all night long and just kind of do all their fun work.
So brushing your teeth at night isn't necessarily, I mean, it obviously removes, for lack of a better term, it removes the bad stuff, but it also removes some of the stuff that the bad stuff feeds on.
That's,
so
I
if
think,
you're
the main
leaving
thing,
debris in your mouth and you're not brushing it, you're essentially leaving food for the bad bacteria to feast on, which makes more of the bad bacteria.
Yes. Yeah. That's the crazy thing too. It's like we always talk about like, oh, there's one of these 2 bacteria that cause cavities, but a lot of times when you start really digging into it, there's, you know, tons of them. They talk about sometimes hundreds of different species that are all basically forming this complex network that once one species starts going, then it wakes up the other ones. And then all of a sudden you have a bonanza of all these different ones growing these little colonies, the biofilms we talked about. So yeah, you're trying to remove their food sources so they don't have much to feed off of. And then literally too, you're trying to literally break up those films so that your saliva can get in there, clean it out, wash them out, break them up.
I want to move to insurance because I know that's a question you get a lot. It's like the most boring part, I think, of medical care is insurance.
Yes.
It's like,
yeah, that's the part I hate talking about, but I have to.
But yeah, and it seems like this really drives the health discussion, sadly.
Oh, yeah.
And is like, do people have to go? Like, you know, I have Acme Insurance Company. It's not a real insurance company, but I have Acme Insurance Company. Do I have to go to network like who they call in-network providers? Is that like a rule or a law? Or can I just pick anybody I want to?
I mean, if you want to use your insurance benefits, then yeah, it just depends on the insurance plan. Some of them will let you go out of network. They'll just pay less. You know, like so Delta Dental do that sometimes. They'll be like, oh, if you see an out-of-network provider, we're going to pay 80%. You know, but if you saw somebody that we chose or that works with us, then you get 100% coverage for your basic preventative, you know, and then once again, they get some insurance companies that are a lot more restrictive. They're like, if you see anybody that we don't work with, it's $0. We won't pay $1. So, I mean, if you want to use your insurance, then yeah, you have to kind of play by their rules, unfortunately. And that's why I always tell everybody when they're like, what insurance is best? I'm like, read the fine print. Because I have people coming all the time like, oh yeah, I got $5,000 that I can use. Well, then once the time you start reading the fine print, it's like, but they only pay for like 2 extractions a year, 2 fillings a year, and that's it. So it's like, great, you have $5,000, but they really don't actually pay for anything that you actually want to do.
Right, because that's confusing. I think people don't really get it. They think they're supposed to go to in-network, or they think, you know, they hear the nightmare stories just in healthcare in general. So they're like, if I go to the dentist I want to use or the one I really like, my bill is going to be $50,000 and it's going to put me into medical debt.
Yeah.
And like, yeah, I mean, if you're going to cancer treatment or something crazy like that, yeah, that's where those big numbers come from.
Yep.
But do those big scary numbers come from dental care though? Like, let's use an example. Someone wants a dentist and they just want to go to a dentist that has no insurance coverage at all. Their insurance doesn't cover them at all.
Yep.
What's generally like a range of a cleaning? What is that going to basically be?
And that's what I'll tell people a lot of times. Like, because I have people all the time that losing their coverage, or friends of mine that'll call me. I'm like, dude, you know, if you're coming in even just for some of them like once a year, I was like, great. You know, if you don't have many problems, you're not going to spend that much money, because then they'll show them like an insurance plan they're going to sign up for. I'm like, dude, you're going to spend twice as triple as amount you ever do by just signing up for this plan.
Oh.
So a lot of times I'll be like, just do x-rays with me, once a year, or if it's once every 2 years, because they have really good health, then sure. And then a cleaning once a year. Yeah. Like what's clean's like $90 exam. Like if we do like dental exams, like $50 to $60. So, I mean, yeah, maybe you spend $200 for just getting x-rays, an exam, and a clean a year. And if you have relatively little issues, I mean, yeah, you're going to spend a lot more doing dental insurance. That's for sure. Once again, but if you have tons of problems, then maybe it is. And then once again, too, changes if you're working for an employer, because some companies will provide dental insurance because they get a tax break for offering it. So then that changes the dynamics of how much it's going to cost them. So it's something we're dealing with, and that's why we've even our office, there's tons of offices now since we started it too, like tons of offices in Metro have been doing it. They do these like membership plans. So it's kind of like, hey, if you pay it all ahead of time, one lump sum, then, you'll pay less for like your 2 cleanings and stuff than you would cash services, because you can't come along and say, oh, you're a cash patient, you pay less. Because then insurance companies just freak out.
Oh, yeah, sure. So in general, then, like the upfront stuff, just the exam and the cleaning is within that couple. It's going to be under a couple $100. And if there's like big problems, then you're like, hey, there's some big problems. Here's what that looks like. But is that generally accurate?
Yeah. And that's why someone has like a lot of problems. And I'm like, still like sometimes if like a filling or two, I'm like, it's still not worth it. But then I get some people, it's like a lot of issues going along. And I'm like, if you can find a great deal, it's a good company that doesn't trick you with the fine print, yeah, it might be worth it. Now, a lot of times just hand off to the front. Like, hey, just do the numbers with them, see if it's a good idea or not.
Is there a scenario then where you could go to a dentist that is in network and actually pay more after it's all said and done than if you went to an out-of-dentist like an out-of-network dentist, because the costs are different? Is that a thing?
Yeah, it is. I don't see it often, but I have, and I feel like that's what I've seen. And, you don't ever want to second guess because, I don't really know the scenario when I see other people's work or their exams or treatment plans. But yeah, I've seen that where people go to a place, it's an in-network dentist, like, oh, I'm going to save all this money. But they come out with these ridiculous treatment plans that's like, you have $5,000 worth of work. I had that with a lady that, saw my dad, where it's like, she saw him for years and everything's great. Then she went to a new place that was in network selling all these discounts and stuff, then came back with tons of work to be done, a couple $1,000s worth. I didn't know. And then she was having me take a look, and I'm like, yeah, like last time, everything looks great. My dad didn't see anything. A couple years later, I don't see anything either. You look wonderful. Continue on. And then she was like, are you sure you see nothing? I'm like, no, if this is my mouth, I wouldn't touch a tooth. She goes, oh, well, I just proposed, several thousand or whatever it was, but like that's like 8 cavities or something. Like I was just proposed 8 cavities to do.
Holy cow.
And I was like, really? So in that case, yeah, you would have paid more.
Jeez.
So I don't see it often, but like before, sometimes there's this stuff that I feel like I'm more conservative. So I get sometimes where it's just like somebody would say do a filling on it. I might watch it. I'm not saying they're wrong. It just might be one of those ones where they want to go after it. I may give it a more of a preventative approach. And then sometimes there's stuff that I'm like, I literally see nothing. Like, I don't know what we're talking about. Luckily, I don't see that often. Thank goodness.
So in dental care, I would assume it applies elsewhere, but in dental care, just because someone's in network and your insurance covers them does not mean they're going to be cheaper.
No, not always.
Just like marketing, just like a business, different people can charge different prices. And so if they're covering half, but their price is higher, it might actually be cheaper just to go to out of network.
Oh, yeah.
So how do we find that out? Do we call ahead of time and say, here's who my insurance provider is? How do we figure that out before? Because I think some people, like, granted, the costs are cheaper, but how do we figure that out in advance?
That's a great question. Because, I mean, I think that's why a lot of times people depend on the insurance thing, because that is a variable that does have some control. Because, if you come in as a Delta in-network dentist, most of the dentists in the network have agreed to a certain fee. Where then if you're out of network, they all could be all over the place. So, you have that across the metro. Like, I have people that'll ask me about fees, and it can be hundreds of dollars of difference. But how do you know unless you shop around? And once again, who wants to go to a bunch of different exams at different dentists and then get all these plans? Because how much is that going to cost?
So you can call ahead of time and essentially get a general quote.
Yeah, you should be able to. Like, what does your crowns cost? That's something I even thought about even with our office. I'm like, I don't see anybody do it, so I don't know if there's like legal or other repercussions. But what if you just posted all your fees for everything that you do? Like, here's what we charge for fillings. Here's what we charge for x-rays. In some ways, I'm like, that's probably a good idea for more. Because it always, calls for healthcare, like more transparency. Like, what does an MRI cost amongst different hospitals? There's always that. So I'm always wondering dentistry. But I'm like, okay, but am I going to open up a can of worms if you start posting that? I don't know. I mean, I think it's something I've always thought is a good idea, but I'm always afraid of the legal side of everything in life. But yeah, I think generally that's why some people do get second opinions too. Most people won't, but I think that's why sometimes people do get second opinions, and I've had people come in second opinions and they're like, oh my gosh, this is so much different. And then sometimes I'm saying exactly the same thing the last dentist said. I'm like, yeah, there's nothing different I would do. Like, they're right, so if you feel confirmed by what I told you, want to keep seeing him, great. I'm happy just to make you feel at ease, because at that point I'm just like, let's just get you taken care of. So I've had times where I've had even patients where it's like their kids, but the kids don't come see me. I'll look at the x-rays and they'll be questioning it. I'm like, yeah, no, it's a totally good treatment plan. It's fine. They're not swindling you. And they're like, okay, good. I just needed to reassurance. I'm like, yeah, go ahead and see them. They'll take good care of you.
Interesting.
No problem.
Dr. Corbin Brady, the owner of Brady Dental Care. What's the website in case people want to reach out and learn more about what you're up to?
Okay. So yeah, I mean, how much I'm up to, I need to update my website better, but it's www.bradydentalcare.com. So BRADY dentalcare.com.
Thanks for coming on the show.
Yeah, no problem.